is my guest today. I try to think what I can say to introduce you, but I will tell you what I heard about you. A force of nature, someone who gets things done, a great clinician, a researcher, an educator. You are also the biggest inspiration in the Middle East for young professionals who want to go into headache. Dr. Ozge, welcome to the IHS and to the International Headache Conference in Seoul. Thank you for accepting to be here.
Thank you, and for your pleasure and my pleasure to your great work. Thank you.
Can you tell us a little bit about yourself? So this is what I heard, this is what I've seen so far, but how do you describe yourself? Tell us about yourself.
Actually, I am an adventure. I am going to an adventure in the headache area since 2004. Okay. First time I made a comprehensive school-based childhood headache study, and then actually maybe 2003, a Childhood Adolescents Congress I invited, and since then I am a member of this family.
So
and
IHS, this is, yes, how many congresses have you attended?
More than 20 years.
Okay.
I am inside the family. And first time I'm involved this family with my studies about children and adolescents. It was a very big experience to me. We made several epidemiological, clinical, and laboratory studies about it. And I hope we help some increasing awareness about the children and adolescents' headache disorders in our field. And then I know lots of the respectful researchers in this way, and I'm very appreciated all of them. Then we increased our awareness in our country, in Turkey, and we created lots of the epidemiological, clinical, laboratory-based studies altogether. And then we tried to collaborate to other countries around us. For example, MENA regions, mm-hmm, and Turkic countries, and some Asian countries, and as well, of course, European and American colleagues of ours. And we learned much of the things, all of our collaborators in this adventure. And each step, our vision enlarged by their contribution to our vision. And nowadays, we are talking about enlarging our vision, a constructional method, for example, senior and junior mentorship methods, and collaborating studies for the developing countries with the underdeveloped countries altogether. And this model, I hope it works. And for a while, we are also focusing on the sustainable, cheap solutions on the headache disorders. Yes. We need to find a way to reaching the people everywhere of the world. I know evidence-based studies is very important. We need much more studies, evidence-based data on the headache disorders, of course, but also at the same time, we need to much more easy way to defining a headache disorder.
Yes, especially for the people who have no experience. We do not have enough specialists, yeah, anywhere in the world. So right, to start a little bit earlier and try to find ways to teach others or those who are in primary care, yeah, easier, because I studied migraine and headaches, and the first thing they taught me was red flags. So I got scared before I got confident that there are green flags. There are good things that we can learn that will help us be less scared to touch someone with headache, because headache is very common.
Yeah, we need to teach each step. We need to teach the patients. we need to teach the nurses, we need to teach the primary care physician everywhere. For a while, we are now on the door of the launching a new collaboration with the WONCA. WONCA is the International Society of the Family Physicians.
Nice.
And they have more than 500,000 members. And between the IHS and WONCA, I was leaded a new project. And for the way we will enlarge our vision in the primary care physician base. It's very important. And another issue is the teaching the workplaces.
Yes. That's a big one, right?
Workplaces burden is very big issue, and stigmatization another issue. It creates much more hopelessness and increased burden and freaking out and increased anxiety, depression, chronification of headache disorders. A circle will start, and we have to keep our patients from out of the circle. For this reason, we are collaborating with the EMHA in the migraine-friendly workplace project. And in Turkey, we are also leading us this project, and we gave some certification, some of the workplace. Yeah. Some of the workplace is migraine-friendly workplace, and it works. It works.
It does, because
it's our main, amongst our aim of the objective in the first years of our country.
Because this is, especially migraine, hits when people are most productive, hits more women. So there's a disparity, there's a little bit of a gap. I'm not going to say a bit of a gap, a big gap between what people are capable of and what restrictions and how disabling this condition can be. And just a workplace that is a little bit more accommodating can make all the difference in a human being. We might never find a cure. I don't think we will ever find a cure to migraine. I know I should be a little bit more optimistic, but at least we need people to live with dignity, to live as close to a normal life than what they are today, suffering in a lot of them in silence. A lot of them don't even say. They are scared to say to the workplace, I have migraine.
Yeah.
Right? They're worried that they're going to get fired, or they're going to be seen as less productive or less important, or any of these stigmas that still exist.
Yeah. Actually, stigmatization is a very important issue. Another issue is the lack of the empathy. For example, one of my postdoc PhD is here. He's very clever guy and very altruistic person, but he had a very severe migraine attack in the last day. He had to miss one day of the meetings, even
that he traveled half the world to come see
he
him.
liked in the heart very much. You cannot define when your migraine attack will start and how long does it take and when it stops.
Yes.
Even that, we don't have any solution that go away in a second.
No.
We don't have a magic, okay? For this reason, we have to understand what happened there. And especially in the workplaces, in the migraine attack, you don't have any biomarker they can make clear. For example, if you have a diabetic coma, they can see that your level of the blood glucose and realize, yeah, you are right, you are diabetic coma. For example, angina, they can see your electrocardiogram and they can realize, yes, you are unstable angina.
They can confirm that they don't dismiss you. Nobody can tell you you're not having it, because how are you going to prove you have a headache?
They couldn't realize what happened in your brain and what you feel that and how much burden you have. It is an important issue. I hope we will have a much more easy and accessible and sustainable biomarker in migraine attacks to make clear as much as the other disorders and increase the awareness of the workplaces and everywhere, everywhere. Other issue is the comorbidities sometimes creates a big gray zone in the headache diagnosis, especially in the migraine. For example, comorbidities with psychiatric disorders like anxiety or depression sometimes creates a stigmatization. Another issue is, for example, increased ratio of the atopic disorders creates a misdiagnosis as, for example, rhinosinusitis.
Yes.
Yeah.
I still see a lot of people saying I have sinus headache. When you ask them about their symptoms, they have migraine. And for years they are taking these decongestants and they are the neti potting and all these antihistamine, and nobody even diagnoses them. And the diagnosis, underdiagnosis, is this still a big problem in Turkey, underdiagnosis, you think?
Yeah. At least myself, I gone 2 unnecessary surgery for my sinus. Can you imagine that? Why? Because I was young and my doctor said you have rhinosinusitis and you have to go to the surgery. Yes, I said yes, okay.
Of course, because it's going to solve your problem.
Yes, okay. A little bit my sinus problem solved, but my headache attacks, it was gone.
So you live with headache yourself?
Yes, I have migraine.
Okay.
I am a migraine cases, but I am luckily, my migraine attacks is very, very rare, and I never been an attack more, at least once in the last 10 years.
Nice.
Very rare, but when I was young, in that time, I had very frequent migraine attacks. Then I learned how I manage my migraine attacks. I learned holistic approach. I learned the importance of the lifestyle regulation. I learned coping with my stress. I learned regulation my diet, and I learned early intervention of the headache attacks. And for a while, my migraine attacks dissolved by year, and I am fine now.
And has this affected your interest? Do you think that this has something to do with your interest in headache and migraine? Do you think you yourself living with a condition has affected your choice of this as a subject of interest for you? Or do you think it was more the opportunity around you? What do you think played a bigger role in you taking
Actually, human is human. Body is body, brain is brain.
Yes.
And each of the parts interesting others. For this reason, in my priority, not only myself, but also all of my patients, holistic approach.
Yes.
Holistic approach. For a while, I can regulate the comorbidities. I can regulate the trigger factors. I can regulate the other cofactors of the environment. For example, breathing air and the light and screen and the other pollution and the sounds and the stressor and the diet-related changes.
Yes.
Everything we have to care about. I am a doctor, of course, but I also have to direct my cases.
Your body is still human, even.
Yes.
Your body is still human body, even if your brain has all this information. And I'm very, basically, I don't want to. I want to say very inspired. I don't get headaches myself, but when I had COVID, I had a disabling headache, and I thought maybe it was life's way of teaching me how difficult it is for people living with migraine to wake up and you can't even open your eyes because the pain is too much. you can't eat, you can't drink, you want to throw up. I had all the symptoms that felt like what I read in books about migraine, and I wondered, how do people living with migraine end up achieving so much? I don't think I could have achieved as much if I had to live with a condition, and wonder if this is a lot of the people who are in the migraine field. Also, a lot of the people I met, they say, yeah, I have the condition, I understand the condition, and I'm able to help patients more because I do not tell them, or I do not believe them. I know that when they say they have a headache, I know what it feels like. Do you feel that this is, I don't have the condition, I still feel that we all need to be helping, but do you feel having a condition means that you are able to help your patients better?
Of course, empathy, realistic expectation, collaboration, communication is very important. We need to create much more collaboration to other disciplines. We need to create much more collaboration between the countries, and we need to collaborate much more communication between the patients and the physicians and all of the team.
Yes.
Physicians is not only the doctors. We are a member of the group. We have to have a broad team working together with us. Nurses, the therapists, and the other disciplines have to work with us. On the other side, we have to gain much more young enthusiastic person to work with us.
True.
Because otherwise they are gone into MS area, for example.
And that is something that when I started working with headache, everybody was telling me it's boring, like it's headache. And I've never seen two patients come in that are the same. While with diabetes, with cardiovascular, I see that there's a pattern. But with migraine and headache, I can't understand why someone would think it's boring. It's actually, each and every person comes with a story, with a trigger that's different. What works for them is never the same. What doesn't work is never the same. The triggers, the lifestyle. I have people who are very fit, who eat healthy, who sleep well, who do everything. You know, when we look at seeds, they look like they're perfect. They're doing everything. They take the supplements. They still get the condition. And I have people who don't do any of this, and they start doing it, and they see an improvement. You're right. This whole idea of making headache interesting for the young generation, I think it's changing. I don't know. I know in Turkey you are making sure it changes.
Yeah.
I see your students. I see your team walking around IHS. You're a force. I can see you walking to me, and I go like, the future is bright in Turkey for people living with migraine.
Thank you too much. Actually, if we gaining young, powerful behind us, we can do it. I'm sure we can do it. We can do it all together. Otherwise, myself is just one person. I cannot do more.
Yes.
But otherwise, we just lead it, the main topics. But otherwise, we need to young person working with us and good collaboration. Thank you for your compliments.
No, I was very impressed. I was always impressed from afar with what Turkey is doing in terms of the activities. You're one of the most active chapters, I guess, of IHS regionally. I see you collaborate with others, which is also very impressive. You're not keeping to yourself and saying, well, we're Turkish, we have a different language, we don't want to work with the others. I see you in conferences in other areas, bringing your experience and inspiring younger generation. And even I talk to experts, and they tell me, if you want something done, then definitely you need to work with you. So I'm very, very impressed with the work. I'm going to go back to research just for a second and ask you, I love that you started with adolescents and children, because we know we don't have treatment options, and all these new medications are not approved for children. Even the older medications, a lot of them we cannot use in children. Your research in children and adolescents, what is what are you most proud of in the work that you have done for children?
Actually, children and adolescents headaches have to the topic all of us supporting in our option. Why? Because children and adolescents is our future, and we can, if we can manage their headache disorders when they was a child or they was an adolescent, we can manage their future. We can create them a good future health and future expectation in the academical, social life, like that. And we are lucky in Turkey, in Mersin. Why? Because we can work together with our child and adolescent psychiatry department more than 20 years. We learned much of the things from them, and they also learned vice versa. And for a while, I learned that if we give an option to a child, your diagnosis is migraine, you have to regulate your life like that, and if you manage it, you will have this type of future. It works. And
I think,
can
yes.
you imagine that?
I
Lots
believe
of
that.
the children understand what I mean that more than lots of the adults. They can understand, they can realize what they do and why they don't do, and then it works. It works. I am very happy to working with children and adolescents. And another issue, they have several options in the management. There is no option. They have several options, even some intervention. For example, we have several peripheral nerve block-like interventions, options in children and adolescents, in the pregnancy or breastfeeding mom. We have mechanism-based management options. We have several evidence-based data on the holistic approach, also
Cognitive
for the
behavior.
interventions. We have several options. There are no options. I don't like, they feel that we don't have any option. We have to live together with our headache attack. This is not, some of my patients say that I have to be friend my migraine attack. I said, no, you don't.
You have to
don't
be a friend?
friend. Yeah, friend.
Oh, I have to accept it, kind of, and live with it, kind of, more than anything.
She said, I have to be a
how
friend
old
with
was-
my migraine. I said, no, you don't have to friend. This is a disease. You have to manage this disease. Really? Yes, you're right. And then we cope together with this problem, and now she is fine. For this reason, we have to give realistic data to the patients, families, workplaces, employers, and the other area. We have to use much more media channel for increased public awareness, increased physician awareness, to increase the team-based communication.
True.
And also
Even parents, you have to work very closely with parents. The difference
Yeah.
between an adult patient, for me, when it's a child, I have to deal with two different people with two different ideas. So I have to manage the parent and their expectations and how they can support their child, and then I have to work with the child separately and try to find a way that the support that the child gets is through understanding and education to the patient and to the parent, and empowering of the child themselves. Because sometimes the parents think, I will make the decision. But if you empower the child, you educate the child, you possibly will get better outcomes from the child in all diseases, but specifically with migraine, where there's stress involved, there's the child feeling that they are isolated, there's isolation, there's again stigma. There's a lot of work that needs to be done, but if a child is empowered, I have similar experiences.
That's the point. That's the point.
So, final words. What does the future look like for migraine?
We should create headache-free future altogether. It's possible.
You think it's possible?
I'm sure it's possible.
Thank you very much. Thank you for being my guest. It's a pleasure to see you in person after all this communication with online and virtually. It's a pleasure to see you and see the work, and I'm looking forward to hearing your beautiful lecture today. Everybody's telling me this is one of them must see today, and I hope to see you in the future for the next IHS and hopefully other regional events. Thank you very much.
It's my pleasure. Thank you for the invitation.
Have a very good day.